Welcome to Dental Hub. Today's video is going to be on the Federation Dentiere Internazionale charting system, which is commonly referred to as FDI. That word is very long to say, so we just abbreviated it into three letters, being FDI. Okay. In this charting system, it's similar to the universal and to the Palmer charting system that we use in a way that it's used in different areas of the world. It's not mainly used in the US, it's mainly used in other places as a form of charting patients' dentition and treatment that they might need. So, this system uses the number of each quadrant and a number from 1 to 8 for adults and a number from 1 to 5 for children. Now, this is the first system that we've seen on this channel that shows adults and children having both numbers as their labels for tooth. In the past two that we've reviewed, those have adults with numbers and children with letters. Okay. For adult dentition, starting from the midline, which is the central incisor, that will be the number 1, and the third molar, which is your wisdom tooth all the way in the back, will be number 8. Whereas for primary dentition, the central incisor will be 1 and the second molar will be number 5. For adults, it's the upper right quadrant, which will be this one right over here, will be number 1. Then we go to the left, which will be number 2. The lower left, number 3, and the lower right, number 4. So these are the names of our quadrants. Before we know our names of our quadrants is upper right, lower right, things of that sort. But in the FDI charting system, it's going to be quadrant 1, quadrant 2, quadrant 3, and quadrant 4. For children, it's going to be 5. It's continuing from the adults. So the upper right will be 5. The upper left will be 6. The lower left will be 7. And then the lower right will be 8. So we have quadrants 1 through 8. Now let's do our adult arch. So let's label these, all right? We have our upper right side, which is number 1. I'm going to color coordinate so that we see which quadrant goes with what number. Okay, so we have our upper right. This is quadrant 1, so each tooth is automatically going to get a 1 attached to it because it is in the quadrant number 1. Then we have our upper left, which will be 2. Each tooth gets a 2. We got our lower left, which is 3, and our lower right, which is 4. Okay, each tooth get their 4. Now we're gonna go with the next step. So in this charting system, each tooth gets assigned a number. All right. So our first one are going to be 1. Starting from the central incisor, they're going to be 1. Sometimes you see it the way it is over here. You have the 1-1, or you'll normally see it as 21. Some people will say number 21, but you have to know which charting system they're using, because in universal charting system, number 21 is the lower left first molar. That's number 21 in the universal charting system. Okay, but if they're using the FDI charting system, 21 will be the central incisor on the upper left side. This is why whichever office you're working in whatever country you're in, you have to be acquainted with what charting system they're using to chart with. Okay, so sometimes you'll see it as 1-1, or it'll be 2-1, which will be 21, or you'll see 2-1. All right, so our central incisors are going to be 1s. So each quadrant keeps the number associated with it, and behind that number, we get the number for that particular tooth. Okay, so starting in the middle, our central incisors are going to be the 1s. Then we have our lateral incisors being 2s. So on the upper right, it'll be 2, 1 or 12. On the upper left, it'll be 22. On the lower left, it will be 32. And on the lower right, it'll be 42. Okay? Then we have canines being the 3s. We have the first premolars being 4, second premolars being 5, first molars being 6s, second molars being 7, and then we have our third molar, which are our wisdom tooth, being 8. Okay? Don't get this confused and think that, oh, we have 48 teeth in our mouth because that's the largest number. That's not the case. It's just the system is set up in a way that the numbers go from 1 through 8 per quadrant, and then each quadrant is assigned a number from 1 to 4. Okay, so we still have 32 teeth in our mouth, it's just numbered differently. Dentition. We have our upper right, which is number 5. We're just continuing from the adults. And each tooth get assigned a 5. Then we have the upper left being 6, the lower left being 7, and our lower right being 8. Same thing as we did before. Each tooth is going to be assigned a secondary number. Okay, so we have our 1s. So central incisors are going to be 1. So upper right will be 51, upper left will be 61, lower left will be 71, and lower right will be 81. Then we have our lateral incisors being the 2s, our canines being 3s, our first molars being 4s because children do not have premolars. They go from canine to molars, okay? Then we have our second molar being 5s. Okay, so there you have it. We have upper right being number 5, upper left being number 6, lower left being 7, and lower right being 8. Okay, so this system, it's fairly simple. Once you have the entire chart laid out in front of you, it's pretty straightforward to figure it out. And once you get more acquainted with it, you'll be able to easily pick out which tooth is which. It can be a little bit difficult at first to try to remember if somebody tells you, oh, tooth number is 75, and you're going to try to figure out which one that is. It's going to take some getting used to at first, but once you're in the groove of things and you start using it on a regular basis, you'll be much faster at recognizing which tooth belongs to which number. All right? And that is it for the FDI charting system. If you guys would like to learn more about dentistry, please check out some of our videos on this channel. Thanks for watching.